My name's Brenda, and I was diagnosed about a year ago, as a matter of fact. And it took a while because it was something that was not suspected. And on one occasion, I work in the medical field, I'm curious about anything that's unfamiliar, and I happened to look up a word, carcinoid, and was amazed at the fact that all these mysterious symptoms I'd had were actually a part of this one condition. But what was difficult is having it diagnosed by virtue of it not being so familiar to the doctors that I went to see. But the website was just such a savior in that respect, because anytime I thought, well, maybe there isn't anything wrong, and I'd get another symptom, and I'd go to the website and gotten so much information that it led me straight to what eventually ended up being the diagnosis. The Carcinoid Cancer Foundation, it's absolutely the best source of information that I found on the internet. And it helped me, the doctors that were involved in my care. I was able to relay information that they gave them more, almost more of a reason to want to test me from the information that I got from that site.
The first thing I would tell a newly diagnosed patient is, number one, seek an expert in your problem.
Go to a center of excellence, confirm your diagnosis, and find out what's unique. And then understand what the options are for management.
Make sure that when you meet the expert, there's a rapport, because the treatment will not work if you are not a team working together.
You have a very slow-growing malignancy, and that's the good news.
If you have to have a cancer, then this is one we can manage for a long time. And together as a team, we can make this happen for you and with you.
There's no immediate emergency, and we can deal with it in an intelligent, methodical way.
This is a chronic situation, and it's a chronic situation associated with very high quality of life.
Conferences for patients in this patient support environment are such a wonderful place to get the best information available.
Well, in a comprehensive conference such as this, what patients get is really, number one, some really hard facts about their disease. The more facts they know, I believe, the less anxiety there is.
They will have a broader view of the field. They will know more of what's available. They will know better if they're really being treated properly, and will also have a background of information that they can use for asking questions about ongoing treatment or their prognosis, and can be better informed patients.
But the camaraderie of seeing other patients and visiting, it cannot be equal in any other environment. This is a group setting with group and people in charge of their own health, and the support that they provide for each other cannot be measured by anything that those of us from the panel can provide. So I think it's very valuable to the treatment of this disease.
This is really a support group, and they learn that they're not alone, and they have the support of other patients, doctors, nurses, and the whole group that's working together to fight this disease.
Everybody's experience is different, but it's also about realizing you're not alone, you're not isolated, you're not unique, but you're one of a group that may be unique, but you are definitely one of a group.
Many physicians don't concentrate on this particular unusual tumor/cancer.
I participate because I have so much to learn. I'm a cardiologist. I'm not a neuroendocrine tumor specialist, but actually in taking care of our patients, I have to become somewhat of a neuroendocrine tumor specialist in order to understand how that fits in with the function of the heart. So I get a tremendous amount.
I learn every time that I go to one of these conferences. I learn from my patients. I learn from people in the room of what they like and do not like, what works and what does not work, as well as be able to offer an information that's valuable to the people in the room.
It makes the patients better educated. It makes my job in treating them easier, and I get greater satisfaction out of knowing I'm spreading the gospel, so to speak.
My sole intent is to be able to communicate what I've learned from experience and my own knowledge exactly across the board to them.
I feel it's really important to come and speak because I'm a huge patient advocate in my practice. I have strong beliefs that patients should be their own advocate, and I come to share what knowledge I have to help them be able to navigate through the course of their disease with the most optimal outcomes.
There are so many advances in all aspects, on a molecular level, a genetic level. It's very, very exciting.
I think the most important advances in the last 5 years has been not only the improved diagnostic ability, so early detection can prevent some of the problems down the road, but also understanding the pathology better, that not all are alike and they need to be treated differently.
I think probably the biggest advances have been in the clinical arena. It has been the sensitivity and specificity of our diagnostic testing, because you're really looking at the function of these tumors with the newer diagnostics.
Both the use of better endoscopic facilities, such as a single and double balloon. We've also developed the gallium scan, which is still experimental, but can be expected to be in general use, approved maybe within a year. And this will be a tremendous help.
There are important advances in suppressing tumor growth, in suppressing serotonin levels. The development of the drug telotrestat is currently being studied, and it seems to be more potent in reducing serotonin. And I'm particularly interested in that because I want to halt the progression of carcinoid heart disease.
And the one that's been here as a therapy, only one approved for the carcinoid of the intestine, has been the octreotide and lanreotide, the two lookalikes of the native hormone.
For treatment, the forthcoming approval of PRRT will be a tremendous advance, and we won't have to send our patients at great expense abroad for the treatment anymore. So that will help. The development of and approval of target drugs such as sunitinib and everolimus is a distinct advantage, and there are several others still on the horizon.
There have been surgical advances. They've learned, for example, that even if the primary tumor is very tiny and not itself secreting substances, if you remove the tumor at the time of tumor reductive abdominal surgery, the prognosis and the survival of the patient is improved.
I think that we're going to see some of the new drugs that they talked about. And if we see these new drugs and the effects and the symptoms be lessened with these drugs, then that would be a great outcome.
I think there will be more genetic studies developed, and there will be better molecular profiling of their tumors to show specific unique chemistries from which will be taken the information to customize the manufacture of drugs that will be more effective.
As soon as we determine what genes are abnormal and producing abnormal pathway participants, that means that we can narrow the therapy down to just treating that little abnormality, as opposed to giving shotgun therapy, which is associated with side effects. So I think the most exciting thing is defining the genes, finding out how we can approach the genetic abnormalities, and thereby ultimately leading to cures of these tumors.
I believe that the therapeutic modalities that are here now will be repositioned, that the new paradigm for treating new tumors will be surgery to remove the primary, followed by the therapy called peptide receptor radionuclide therapy, wherein you take the hormone lookalike, you put radioactive material that travels a very short distance, attaches directly to the cell and their tumors, and can destroy it.
You know, I think immunotherapy is going to be an exciting field for solid tumors. It's already proving itself in other tumors. And I think as we understand the molecular genetic basis of this unique disease, there will be other opportunities besides the few things we have right now that can boost the immune system to fight this disease even better.
It's a journey, and it's something that I realized it wasn't a matter of just going and, getting a diagnosis and having it addressed. It's a matter of continuing to learn. There's so much new information, and that's what most impresses me about the SUG, the foundation, the Carcinoid Cancer Foundation, is whenever I go there, I learn something new. There's something new happening. There's some new clinical trial. There's just so much more hope and encouragement that I get by virtue of the information that I find there. I'm always surprised at how much I find on that website.